We've all been taught that regular health checkups are the cornerstone of staying healthy, especially as we age. Better safe than sorry, right? What if I told you that some of the most commonly recommended medical tests for seniors might actually do more harm than good? Not only wasting your time and money, but potentially putting your body, independence, and peace of mind at serious risk. Sound shocking? It should, because here's the truth few doctors will tell you up front. After a certain age, not all tests are created equal. Some screenings that were once life-saving in your 50s or 60s can quietly become dangerous in your 70s and 80s. They can lead to false alarms, overdiagnosis, unnecessary procedures, emotional distress, and even hospitalization, all in the name of prevention. But are we really preventing illness, or are we creating new problems that wouldn't have existed otherwise? In this video, we're going to shine a light on the dark side of routine health screenings after 70. We'll reveal 7 specific medical tests that you may want to rethink, refuse, or replace with safer, smarter alternatives. Tests that even some experienced doctors are now choosing to skip for themselves. This isn't about fear. It's about freedom. About reclaiming control over your health in a system that often favors quantity over quality. More tests, more pills, more procedures, without asking what truly matters to you at this stage of life. So if you're over 70 or love someone who is, and you believe that health care should support your well-being, not steal it, then you need to hear this, because sometimes the most powerful thing you can say at the doctor's office isn't yes. It's a well-informed, confident no. Let's begin. Point 1. The colonoscopy dilemma after 70. For decades, colonoscopy has been hailed as one of the most effective tools in the fight against colon cancer. It's often viewed as a life-saving screening, especially when performed between the ages of 50 and 60. But what many people don't realize is that after age 70, particularly in individuals with no symptoms or family history, this same procedure can quietly shift from helpful to harmful. While well-intentioned, routine colonoscopies in older adults often carry risks that far outweigh the potential benefits. The process itself is physically demanding. It requires a full bowel preparation, which involves consuming powerful laxatives that can lead to severe dehydration and dangerous shifts in electrolyte levels, both of which are particularly risky in seniors. For many older adults, this bowel prep alone can trigger dizziness, confusion, and even falls, especially for those who live alone. Then comes the procedure, which requires sedation. But the aging brain and body metabolize sedatives differently. What's mild grogginess for a younger person can result in days or even weeks of cognitive fog, increased fall risk, and heightened vulnerability to post-procedure complications in older adults. Even when the colonoscopy appears successful, the results can lead to a cascade of unnecessary interventions. Many small polyps discovered during routine screenings grow extremely slowly, taking 10 to 15 years to become problematic, if they ever do. For someone in their mid-70s or 80s, those years may never come into play. Yet the discovery of a harmless polyp often sparks anxiety and a chain of follow-up scopes, biopsies, or even surgeries that may compromise quality of life. Take, for example, George, an 82-year-old man in good health who underwent a routine colonoscopy just to be safe. He suffered severe dehydration during prep, fell at home after the procedure due to lingering sedation, and fractured his hip. The test revealed nothing concerning, but the aftermath left him in months of painful rehabilitation and emotional stress. In light of all this, many geriatric specialists now recommend non-invasive stool tests as a safer, more appropriate alternative for older adults. It's not about neglecting your health. It's about honoring your body and recognizing when the cost of prevention becomes a burden instead of a benefit. 2. The hidden Risks of too many bone density tests. DEXA scans. Bone density scans, also known as DEXA, dual energy X-ray absorptiometry scans, have long been used to detect osteoporosis and assess the risk of fractures, especially in postmenopausal women and older adults. While a baseline scan in your 60s or early 70s can be very helpful in guiding treatment decisions, repeating this test too frequently in older age can lead to more harm than good. In fact, many seniors are subjected to routine DEXA scans every couple of years, even when the results don't change, and the consequences of that can quietly spiral. The concern isn't with the scan itself. It's painless, quick, and involves very low radiation. The real issue lies in what comes next. Slight changes in bone density, which may be completely normal with aging, often trigger aggressive treatment plans involving powerful osteoporosis medications, such as bisphosphonates, like Fosamax or Boniva. While these drugs can be helpful, in high-risk individuals, they are not without side effects, and for some seniors, the risks may outweigh the benefits. Common side effects of long-term bisphosphonate use include gastrointestinal issues, inflammation of the esophagus and muscle, or joint pain. But more serious complications can occur too, such as osteonecrosis of the jaw, a rare but painful condition where the jawbone starts to die, or atypical femoral fractures, where the thigh bone breaks with little or no trauma. These outcomes are rare but devastating, and their risk increases with age and prolonged drug use. Moreover, studies have shown that bone density naturally decreases with age, but that doesn't always correlate with fracture risk. A person can have a DEXA score that shows osteopenia, mild bone loss, and still live for decades without ever experiencing a fracture. This is why many geriatric specialists now recommend spacing out or even discontinuing routine bone scans. In seniors who have had stable results and no new fractures, instead, the focus should shift to fall prevention, strength training, and nutritional support like adequate calcium, vitamin D, and protein intake. Bone health is important, but it's about more than numbers on a scan. It's about staying mobile, steady, and strong. Sometimes, putting the brakes on repetitive testing is exactly what your body and your peace of mind needs most. 3. The full body scan trap, when peace of mind creates more harm than good. The idea of getting a full body scan can feel incredibly reassuring, like giving your entire system a once-over to catch any hidden dangers before they become serious. For many older adults, the promise of spotting cancer or other diseases early feels like the ultimate act of prevention. But the reality is far more complicated. In people over 70, full-body scans often do more harm than good, setting off a chain reaction of fear, invasive follow-up tests, and even unnecessary surgeries that can harm health rather than protect it. These scans, often involving high-resolution CT or MRI technology, are powerful tools designed to detect even the smallest abnormalities. But therein lies the problem. They detect everything. That includes harmless lumps, tiny nodules, or minor irregularities that would never have caused symptoms or threatened your life. These are called incidental findings, and while they sound concerning, they often lead to overdiagnosis, identifying conditions that don't actually need treatment. Unfortunately, once something is found, the medical system kicks into gear. More scans, biopsies, referrals to specialists, sometimes even surgery. Each step carries its own risks, especially for older adults. Sedation, infection, hospital stays, and post-procedure complications become far more serious with age. And, in many cases, the problem that started it all turns out to be nothing at all. Emotionally, the toll can be just as damaging. A senior who felt perfectly healthy before the scan might now live in a state of constant anxiety over something they didn't even need to know about. It's a cruel, irony-seeking peace of mind and ending up with fear instead. Unless there's a specific medical reason or symptom prompting it, full-body scans are rarely recommended by geriatric experts. They're not covered by most insurance plans for a reason. The smarter approach? Listen to your body. Pay attention to real symptoms. And trust that aging doesn't mean you need to turn your body into a project. Because sometimes, not looking for trouble is the best way to stay well. 4. Cardiac stress tests. When, just to be safe, isn't safe after 70 for many years. The cardiac stress test has been a routine part of heart health checkups, especially for older adults. Whether it's the treadmill version or the chemical-induced test, the logic seems sound. Push the heart, monitor how it reacts under stress, and catch any warning signs early. But after the age of 70, this once useful test can become more harmful than helpful, especially in seniors who have no symptoms, like chest pain, shortness of breath, or unexplained fatigue. The biggest problem? False positives. As the body ages, arteries naturally stiffen, heart rhythm shifts slightly, and blood pressure fluctuates more. These changes are normal, but stress tests often interpret them as signs of underlying disease. That can lead to a cascade of follow-up procedures like angiograms, catheterizations, and even stent placements or bypass surgeries, all of which carry significant risks for older adults. These include bleeding, kidney injury from contrast dye, irregular heart rhythms, or dangerous drops in blood pressure. Recovery from these interventions is often long, painful, and uncertain. Take Harold, a 76-year-old man with no symptoms. His doctor ordered a stress test, just to be cautious. A minor abnormality led to a cardiac catheterization, which found mild, non-blocking plaque. Yet a stent was placed anyway. Harold developed internal bleeding from the blood thinners afterward and spent weeks in the hospital facing complications from a test he never really needed. Many leading heart specialists now advise against routine cardiac stress testing in older adults without symptoms. It doesn't reduce the risk of heart attacks or extend life in these cases. In fact, it often causes more harm than good. If you're not experiencing warning signs, the wisest choice may be to skip the test and focus on the basics: staying active, managing stress, eating well, and getting good sleep. In this stage of life, thoughtful care is better than aggressive testing. Not every heart needs a machine to prove it's strong sometimes. Your daily walk and steady rhythm are all the reassurance you need. 5. P.S. A testing after 70, when early detection isn't always the right decision for many men. The PSA test, short for prostate-specific antigen, has become a routine part of aging. A simple blood test, it's meant to detect signs of prostate cancer early. That sounds like a good thing, right? But for men over 70, this test often opens the door to far more harm than benefit. In fact, many leading health organizations, including the U.S. Preventive Services Task Force, now recommend against routine PSA testing in older men without symptoms. Why? Because most prostate cancers in older men grow very slowly, so slowly in fact that they'll never cause symptoms, spread, or threaten life expectancy. But once the PSA test flags a potential issue, it often sparks a series of stressful and risky follow-ups: biopsies, MRIs, surgeries, or radiation treatments. These interventions can lead to serious side effects, including incontinence, erectile dysfunction, infections, and chronic pain. Worse, the emotional toll can be heavy. Imagine being told you have cancer only to learn that it was the kind you could have lived with peacefully for the rest of your life. That label alone causes fear, changes how people see themselves, and can disrupt the joy and peace of later life. Take Walter, a healthy 79-year-old with no urinary symptoms. His PSA was slightly elevated, and his doctor recommended a biopsy. The procedure caused an infection that put him in the hospital for a week. The result? A low-risk tumor that didn't need treatment. But Walter's confidence and energy never quite returned. All for a condition that likely never needed to be found. In many cases, watchful waiting or active surveillance is a smarter, safer approach for older men. If you're not experiencing urinary problems or other symptoms, you may not need to go. Looking for a problem that won't affect you. At this stage of life, healthcare should focus on quality, not fear. And sometimes, the most responsible decision is not to test, but to trust the quiet wisdom of your body and enjoy your well-being as it is. 6. Repeating colonoscopies. Too often, a risk seniors can avoid. There's something deeply unsettling about the idea of colon cancer. It often comes without warning and can be deadly if detected late. That fear has made colonoscopy one of the most widely recommended cancer screenings over the past few decades. But after a certain age, particularly beyond 70, the risks of repeating colonoscopies too frequently can start to outweigh the benefits. Yet many seniors continue to undergo this invasive procedure just to be safe, even when they have no symptoms and have had clean results in the past. Colonoscopy is not a casual test. It requires full sedation and aggressive bowel preparation, both of which carry real risks for older adults. As we age, our liver metabolizes medications more slowly, and our brains become more sensitive to sedatives, raising the chance of postoperative confusion, memory problems, and dizziness that can lead to falls. The prep process, which involves drinking large amounts of powerful laxatives, can cause dehydration, disrupt kidney function, and drain a senior's energy for days. More importantly, colonoscopies are designed to detect polyps that may take 10 to 15 years to become cancerous. For a healthy 50-year-old, that makes sense. But for someone in their late 70s or 80s, especially with a history of clear colonoscopies, the odds that a newly found polyp would grow into something dangerous during their remaining years are very low. Yet, fear often drives the decision. To repeat the test, take Eileen, a 78-year-old retired teacher who had 2 normal colonoscopies before. Her doctor suggested another one, just to be thorough. During the procedure, her colon was accidentally perforated, a rare but serious complication. She needed emergency surgery and spent weeks in the hospital recovering. The polyp they found? Harmless. The smarter strategy at this stage of life is to stay alert to real symptoms like unexplained weight loss, blood in the stool, or persistent abdominal pain. If those appear, testing is appropriate. But if you're feeling well and have a good screening history, it may be not only safe, but wise to say no to yet another scope. Your body deserves care, not unnecessary risks. 7. Routine brain MRI scans without symptoms. When curiosity becomes a costly risk in a world where medical imaging is more accessible than ever, many older adults are tempted to request a brain MRI, just to be sure everything is okay. After all, who wouldn't want to check for silent strokes, early dementia, or hidden tumors before symptoms appear? But for people over 70, getting a brain MRI without any neurological symptoms is rarely helpful, and in many cases, it does more harm than good. Brain MRIs are extremely sensitive. They can detect even the smallest abnormalities, tiny white matter changes, age-related shrinkage, or benign cysts that are almost always harmless. But once found, these incidental findings often lead to a cascade of unnecessary tests, follow-up scans, or even invasive procedures like brain biopsies. All of this is done in the name of caution, yet it rarely changes the outcome or improves quality of life. In fact, it can create deep anxiety, confusion, and costly medical journeys for something that would never have become a problem. Take 4. Example. a healthy 76-year-old woman named Linda. She had no memory issues, no headaches, no balance problems, just a little curiosity and a desire for reassurance. Her MRI showed a few white matter spots, which her doctor explained were likely normal for her age. But the radiology report mentioned the possibility of microvascular ischemia, a vague term that sent Linda spiraling into worry. Over the next 6 months, she went through 2 more MRIs, a neurologist referral, and weeks of poor sleep, all for something that required no treatment. Unless you're showing clear signs of cognitive decline, unexplained headaches, vision changes, or other specific symptoms, routine brain scans are not recommended by most geriatric specialists. They rarely reveal anything actionable and can end up being more stressful than informative. At this stage in life, peace of mind comes not from scanning every organ, but from trusting your daily function, staying mentally active, and addressing real concerns, not imagined ones. The brain doesn't need constant surveillance. It needs stimulation, rest, and confidence. As we grow older, it's natural to want to stay one step ahead of illness. But the truth is, not every test, scan, or screening leads to better health, especially after 70. In fact, some of the most common medical checkups can open the door to unnecessary fear, invasive procedures, and a decline in quality of life. From repeated colonoscopies and full-body scans to routine stress tests and overused PSA screenings, the road to playing it safe can sometimes lead us straight into harm's way. What matters most at this stage of life isn't catching every possible problem, it's preserving your independence, your clarity, and your joy. Smart aging means choosing carefully, asking questions, and understanding when less is actually more. Medicine is evolving, and so should we. It's time to move from blind routine to thoughtful care. You are not being neglectful when you say no to certain tests. You are being wise, measured, and deeply in tune with your body's real needs. So ask yourself, is this test likely to change my life or just complicate it? That simple question can be the difference between peace of mind and months of unnecessary medical intervention. If you found value in today's video, please like, comment, and share with someone who may need this message. Let us know in the comments which test surprised you the most, or what change you'll make moving forward. And if you haven't already, subscribe to Elderly Stories and hit the bell icon so you never miss empowering content like this. We're here to give you not just information, but confidence, clarity, and a voice in your own care journey. Thanks for watching. Remember, growing older doesn't mean giving up control. It means owning your story more than ever.